Welcome back to Great Day Washington. Throughout the month, we've been featuring stories of breast cancer survivors. Well, our medical partners at Reston Hospital Center gave us an inside look at their breast care program as they're urging everyone to talk to their physicians about their individual breast cancer risks. The best way to prevent breast cancer is early detection, but there is conflicting information out there about prevention and treatment.
You need to know your body.
And experts say this can lead to hesitation among women to take the proper steps in getting checked.
So if you have a new mole, you need to tell your doctor about it. If you have a new lump in your breast, you need to tell your doctor about it. If you have a change in some other normal bodily habit, you need to tell your doctor about it. Because if you're not aware of it, nobody else is going to be.
Breast surgeon Dr. Elizabeth Feldman of Reston Hospital Center says noticing changes in your body should warrant an immediate visit to your doctor's office. But you should also have a conversation early on about your personal breast cancer risks and talk to a medical professional during a routine visit about how often you should get a mammogram. The answer is not the same for every patient and every woman.
70% of breast cancers are picked up by mammograms, not by self-breast exam.
So my name is Marcy, and I'm a mammography technologist here at Reston Women's Imaging Center. So we do the front pictures, and then I rotate the machine.
Oh, wow.
Yep. And then we do a side picture where the patient stands something like this, and then we compress from the side.
And what do you look for in a mammogram?
We're basically looking for indicators of cancer, so little masses or little calcifications that can indicate that there's something hiding there. I mean, we're also looking for big masses and big calcifications, but frequently those can be felt. So we're looking for smaller, earlier cancers so we can kind of get a jump on treating patients.
Dr. Judith Kaplan is a radiologist and explains how mammograms that come back with an abnormality don't always mean cancer.
So I think that the thing that is most frightening for women is when they're called back from a screening mammogram. I think a lot of women panic because it's very anxiety-provoking. We're using mammography as a screening tool to find abnormalities, but not every abnormality is significant. I think it's helpful for women to know that when we're asking them to come back, it's because we have a question. You know, we want to gather more information to figure out if there's a problem.
If a biopsy is needed to help determine if an abnormality can be a threat, the team at Reston Hospital's Women's Imaging Center has a navigation system that ensures your next steps are as smooth as possible.
When a patient comes in, once they're told that they need a biopsy, I get called and I meet the patient at that time. And we discuss what the biopsy is going to be like and what we're going to need pre-biopsy just to get them set up.
The biopsy is the last step for many patients, but unfortunately for some, the experts will find that more action is needed to stop an aggressive tumor.
I meet with all the newly diagnosed breast cancer patients that come in to see Dr. Feldman or Dr. Opong. I provide an educational binder with nationally recognized resources and local resources. I help with appointments to other physicians if needed. I do surgery education, post-op education. I meet with them on surgery day to make sure everything goes smoothly and provide support.
Dr. Bridget Opong is a breast surgeon and explains how advances in treatment give breast cancer patients many more options now than in previous years.
Thank goodness that there's a lot of advancement, so women are doing very well with breast cancer. There's some surgical advancements, meaning we do our procedures very differently. We're able to save the nipple, for example, which is a way of performing the mastectomy that leaves a really optimal cosmetic result. We try to do less invasive procedures, smaller incisions.
There are also advances in radiation technology and chemotherapy, which can cut down on treatments needed and recovery time.
Delivering it in a way that's reducing a lot of the side effects.
But Dr. Opong stresses that patients shouldn't be afraid to follow up with their doctors if they feel they need a little extra attention, even if it's to help calm the nerves.
Everybody thinks they're going to die. And not to make light of this, but that's the first thing. And again, I really stress to patients to, sort of, we need a lot of information, to tell you how this is going to behave if indeed it is cancer. A lot of times, again, we're seeing patients who have benign lumps, so I think the number one question is people are concerned, am I going to make it? And I tell them, absolutely, even at the worst, we have a lot of treatments, a lot of options for breast cancer. So I always want women to maintain their hope.
And maintain their hope. And the gift basket you see here is donated by the 3Bs Foundation for mastectomy patients. And the stepsisters, they donate gift bags for people who are undergoing chemotherapy just to make them feel more comfortable. Reston Hospital Center also has 2 support groups, so you can schedule your next mammogram today and feel confident that they will help you out. You can visit restonhospital.com to meet the team at Reston Hospital Center. We'll be right back.